My name is Professor Keyoumars Ashkan. I'm a professor of neurosurgery at HCA, and my main areas of interest are brain tumors. So various aspects of brain tumor surgery, different techniques, and also other non-surgical modalities like radiosurgery, cyberknife, and gamma knife. Visual aids, minimally invasive brain tumor surgery. I also specialize in neuromodulation, so procedures like deep brain stimulation for movement disorders, or spinal cord stimulation for intractable pain, or occipital nervous stimulation for headaches. I've also got interest in degenerative spine disorders, so cervical neck pain, if you like, cervical surgery, or back pain, lumbar spine surgery, laminectomies and discectomies. And as I say, I've got an academic interest being a professor, so a lot of research. And as I say, my NHS practice is at King's College Hospital, so King's College London, and also provide private practice and private care at the HCA, particularly Harley Street Clinic. So actually, it's a very interesting question why I decided to do neurosurgery. Funny enough, I wrote an article in the British Medical Journal section quite a few years ago explaining why I chose neurosurgery, but it's always a pleasure to talk about this. I think from my point of view, there are two different types of neurosurgeons. There are those neurosurgeons whose main commitment is the technicality of the surgery. So if they didn't do neurosurgery, for example, they would be doing surgery in some other branch of medicine. And there are others, like myself, whose main interest and fascination is with the brain. I mean, I think brain is the most fascinating, complex structure known to man. And I'm very interested to understand how it works, how it gets affected by disease conditions and how we can treat those disease disorders. And out of all the different neurological, brain-related disciplines, so neurology, neurosurgery, neuropathology, neuroscience, neuroradiology, etc., I'm most interested in neurosurgery because I think it's a privilege to be able to handle the brain, treat the brain conditions for our patient groups. And technically, it's very demanding and very challenging, so that hugely interests me. But the academic side of trying to understand these disease processes and then do something positive about them is probably what attracted me most to neurosurgery. So if I wasn't doing neurosurgery, I'd probably be a neuroscientist of one form or the other, but it's an honor to be a neurosurgeon and not only treat this fascinating organ, but also treat this very, very deserving group of patients. What I find most rewarding about my job are the type of patients I have to treat, because patients with brain disorders often are a very, very difficult cohort of patients in terms of the kind of conditions they have to deal with. So let's just take a patient with brain tumors. Unfortunately, despite all the advances, there's still a huge amount of work to be done, and these patients unfortunately have massive impact because of the brain tumor on their quality of life, longevity, their social functions, etc., etc. So to be able to help this cohort of patients is a huge privilege, and it is I guess it's what I wake up every day in order to do. As I said, there are massive challenges because these patients are often very complex and have got a variety of needs, quite difficult areas to address. But I think those challenges are what really drives me and what attracts me to this discipline, because I mean I see them as puzzles that need to be solved for the benefit of our patients. Equally, I mentioned another area of work I do are patients with movement disorders in terms of neuromodulation, a process called deep brain stimulation, which can be used for Parkinson's disease, for tremor. Again, many of these patients may not respond very well to medications and have major impact on the quality of life. I mean, some of these patients with severe tremor may not have been able to hold a cup for decades. And with the surgeries that we can do, we can make a huge impact. And it is amazing to see 1 minute the patient is not even able to hold a cup of water, and the other minute, once we've done the operation, almost instantaneously you can see the change and the impact you make on patients' quality of life. All the things we take for granted is not available to many of these patients. So it is, again, as I said, it's what drives me every day to get out of bed to try to help this patient cohort. So what can patients expect when they see me? I think probably first and foremost, empathy. Patients come and see you at the most difficult time in their lives. So they deserve empathy. They deserve somebody who can listen to them. So I think that listening factor is very important. Many patients may be uncomfortable sharing this very, very important aspects of their life, opening up to somebody that they are meeting for the first time. So empathy and the ability to listen, I think, is crucial aspect or quality of a doctor. So I hope patients can expect that from me. I think my approach, I tend to be a very friendly person in everyday life. And sometimes the way you interact with people can be a barrier in terms of engaging with them and getting all the information you need to be able to help them. And I think that barrier, I hope, doesn't exist with me. I'm a very friendly person, and what you see is what you get. So I will listen, and I will reciprocate in my communication with the patients. So we are all on the same level, and we all share in terms of decision making and how we proceed. So there is no differences in terms of the way I would want to proceed the treatment with respect to my view and the patient's view. I tend to share with the patient about the management plan, etc. So I take into account and consideration their feelings, and as I say, we get joint decision in terms of what we do, not a diktat from my side. And I think that's very important. I keep myself at the forefront of the fields that I'm working in, so I will hopefully be up to date with the condition I treat, and that means that patients can expect to have the most up-to-date and most advanced treatments available. Not only keeping myself up to date with what is going on out there, but again, as an academic, it's my job to lead the field. So I'm involved in a huge amount of research, trials, studies to produce and provide new and novel treatments. And again, patients can expect someone who will tell them about what can be done over and above the standard, if you like, and discuss those with them, and hopefully provide the cutting-edge treatment that all those patients deserve. I think those are probably the main aspects. So empathy, ability to listen, friendliness, being able to be at the cutting edge of what we do. So the most up-to-date treatments, the best available surgical techniques. And I think a good doctor, first and foremost, even before a good surgeon.